My name is Jeff Foss. I'm a pharmacist at City Pharmacy here in Corner Brook. I've been here 28 years. I know you wouldn't say it because I must have started when I was 12, right? Yeah. So I've been here 28 years, graduated in 1990 from Memorial School of Pharmacy. We were the first graduating class. We were introduced to almost every possible topic when we graduated. So our class motto was, Jack of all trade, master of none. So, but anyway, I work here at City Pharmacy. I've been here ever since 1990. We did start a little satellite store down in Cox's Cove 19 years ago. Been going there for the last 19 years. That's it. That's me. Hello.
Our topic obviously is medication non-adherence. So what is your personal experience with medication non-adherence, being a pharmacist for all these years?
For all these years. With the new computer systems now, whenever we get a prescription or someone calls in to get a refill, there's a column in the patient profile that shows when they're due, or so it will show minus days if they're gone beyond when they're supposed to be due, or there's still plus days, meaning they still should have these plus number of days left. So that's great with the new computers today. Years ago we didn't see that, we didn't have that screen. So it's, I would say 90% of the people that get their prescriptions filled, they're usually way beyond the time they should have gotten it filled.
Yeah.
So it's quite common to see people late in getting refills.
Yeah. So would you say that seniors are more population getting medications over the younger adults?
It's hard to say that as a general comment, because the majority of our customers here are seniors anyway. So I guess in that case, yeah, I do see it more in seniors. But no, I see it in anyone from 30 years and up. It's pretty rare to see younger individuals not taking their cholesterol, not taking their blood pressure meds, or not getting their insulin on time, this sort of stuff. No, it's usually the older people for sure, yeah.
Okay.
I guess I'm classified as an older Yes.
So on a day-to-day basis, per se, do you ever have to deal with a patient that comes in and says, you know, I haven't been taking my blood pressure pills for the last 3 months? Again,
seeing that minus and the pluses on the screen is great for us. And again, a high percentage of people, they are way off the mark in getting their refills on time. So, and most people call it in, which is great. So you're on the phone with them, their phone, and say, yeah, I need my blood pressure pills. So I'm looking up, I said, Ramipril, you still taking that? He said, yeah, I'm still taking it. It's like, but you're 60 days past due. You were supposed to pick them up 2 months ago.
Yeah.
So how do you take them? Well, I take one a day. It's like every single day. But 90 days ago, you had 30 days supply, so you can't take them every day.
Yes.
So, well, sometimes I miss it, So,
what do you think are the reasons why seniors aren't adherent to their medications, above all people?
Yeah, seniors are probably the worst. There's many reasons. There's so many reasons. It could be economical, because even though a lot of the seniors now, they're covered under the seniors program, so they pay a $6 fee if they're covered under the Newfoundland program. Again, the large majority of people have insurance coverage too, which is great. And we probably see less of an issue with those people because it's not so much a financial burden for them. But even with a senior paying $6 for up to a 3-month supply on some medications, they would still try to stretch it out, because a senior could be on 10 medications, $60, and I'm on a fixed income. Well, not me, but there's seniors that are on fixed incomes, and $60 is $60. It's a lot.
Yeah.
It may not seem much to us, but it can mean a lot to them. So I think that is probably the main thing.
So for the uninsured patient,
uninsured, generic prices of drugs have come down a lot in the last 2 to 3 years. So I would say it depends on what you're on, because we're seeing more and more people, especially here in Newfoundland, diabetics, heart and stroke issues, and those meds are terribly expensive.
Like the insulin.
Oh my goodness, on your Lantus and your Novo Rapids and stuff, and then you're using your test strips. Test strips are $1 a piece, right? So if you're a diabetic, you could be spending $500 a month. You know, you're on no meds, and then all of a sudden you have a heart attack or a stroke, and then you come out and now my meds are $300 a month. So yeah,
Yeah,
it can be really
that's
expensive.
a big barrier.
Oh, for sure.
Yeah, why some people just don't even bother taking their meds at all.
Yep. The other thing is forgetting. It could be, this particular patient here is on 10 different medications. So give yourself 10 bottles on your table in the morning.
Yeah.
I mean, I have an issue if I gotta take 2 different meds,
Exactly.
3 times a day for one and 4 times a day for the other. So, okay, so if this one's 4 times a day, then it's every 6 hours. This one's every 8, and it can be confusing. It definitely can.
Sure.
Or you're not gonna take them the right times throughout. So it could be economical, could be just confusing because the dosage times it's just hard to follow.
Yeah.
Right?
What about adverse effects? You know, sometimes patients experience that and they won't.
Perfect example there is cholesterol medications. We get so many people that are on different statins that cause leg cramps, leg issues.
Yeah.
So they just don't take it, or they'll take it every second day or every third day, or they'll stop it altogether when they call for refills. Like, oh yeah, I said, well, aren't you taking your cholesterol pills? I stopped those. It made my legs cramp up and everything.
Yeah.
Well, once you go see your doctor, you might be able to do something else. At least get your levels done, blood work done, right?
Yes.
So yeah, adverse effects could be one, or it gives me an upset stomach and da-da-da, which is great if that comes up, because then we may be able to help them. Oh, you shouldn't be taking it then. You shouldn't be taking your potassium before you go to bed. You should take it earlier in the day and whatever.
So that's where you come in with the education piece.
Correct. Yeah. So usually when we see those discrepancies of when they should be coming in for the refills, then we'll ask them why. Like,
Further investigation.
exactly. Yeah, or they misinterpret what the medication is for.
Yeah.
And because again, we've got that too. I need my blood pressure pill. Oh, your Ramipril. No, that Crestor.
Yeah.
No, that's not for blood pressure. That's cholesterol.
That green one.
Oh, yeah, fill me the green one. Yeah, or that little white one I'm on. Yeah, exactly.
Sure.
So then they get their medications mixed up. So again, they could be taking it wrong, or oh, I don't have bad stomach today, so I don't need to take that pill. But no, that's your cholesterol pill. You got it mixed up with your Pariet or your Losec. Like,
so strategies to improve medication adherence from your perspective. What can we do? What can you do?
educate.
Yeah.
First of all.
Big one.
Yeah, stress the importance of taking your medication properly to prevent further issues. Stress what they're for so that they understand that, yeah, it is important for me to take that. Or like we had mentioned earlier about the silent killer, the blood pressure issue. I don't have any symptoms. I don't need to take my blood pressure pill. But yes, you do. Or I'm sure I'm fine. My cholesterol must be good. I'm exercising now. I'm eating right, so I'm not going to take the Crestor anymore.
Yeah.
No, did you get blood work done? So education that way is a big thing. Education on stressing what the meds are for and why they should be taken. It's very important. But then also helping them with these other aids.
Yep.
I know everyone's seen the little dosettes, which is Monday to Saturday type thing. You can get different colors for times of the day. You can get them with 4 different slots. The other thing, sometimes they can't swallow the pill. The pill's too big. I can't swallow that.
Yeah.
Then we can crush it up. Again, check with the pharmacist or physician to see if they can be crushed. You can cut them up to make them smaller, those sorts of things, the blister packaging. So we would actually do up the entire month, 4-week supply for a patient, and we would break it down into 4 different time slots.
Well, thank you, Jeff.
Oh, my pleasure. And Shelby, our camera person. Hey, Shelby back there.